Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Best prenatal treatment for congenital adrenal hyperplasia is dexamethasone. A newborn with 46XX has external genitalia of the male. All of the following are possible causes except the patient, she is a female patient, genetically she is female, but external genitalia are of male. This can be due to maternal androgen hormone tumor. Yes, if the mother has androgen hormone tumors, the androgens are produced. These androgens might change the might result in male external genitalia. Okay, Wnt4 mutation. Wnt4 mutation is responsible for ovarian or development of female reproductive system. But if there is mutation in Wnt4, there will be some issue in the development. So this might result in external genitalia in the male. Then we have placental aromatase deficiency. If there is no aromatase, then testis cannot be converted into ovary in the mothers, in utero life. So as a result, the baby does not get the ovary. So though she has 46XX, that is female genotype, the androgens become dominant, and as a result, external genitalia of male is seen.
Aromatase will cause conversion of testosterone to estrogen. So because of placental aromatase deficiency, estrogen will not be there because of testosterone cannot be converted to estrogen because of aromatase deficiency. As a result, testosterone levels increases, so the baby will present with male external genitalia.
Then anti-Mullerian hormone deficiency. If there is anti-Mullerian hormone deficiency, then in this anti-Mullerian hormone deficiency, the anti-Mullerian hormone is uh, not there. So that means the Mullerian duct will start proliferating. So in this case, this anti-Mullerian hormone deficiency is actually seen in 46XY. That is, it is seen in males. In these patients, actually the gonads will be testis and the hormone will be testosterone. Okay, but here the child is 46XX. So this is the wrong statement.
thank you and thank you for watching.